Risks of subclinical iodine deficiency are not limited to pregnancy, and infant neurological development, or weight gain. Nearly 2 billion people worldwide don't get enough iodine in their diet, and 50 million suffer from brain damage caused by the deficiency. This may very well be the most preventable cause of brain damage in infants and children, and yet 36.5% of children are estimated to have an iodine deficiency. Even a small deficiency in an adult's iodine level may reduce your IQ by up to 15 points, which may affect your ability to get a job and keep it. Subclinical iodine deficiency is also known as iodine deficiency disorders that are subtler than a goiter and may be more dangerous. Iodine helps prevent oxidative stress that may lead to chronic diseases such as diabetes, atherosclerosis, and arthritis. When your thyroid is not fully functional, it can also lead to heart disease. Other tissues in your body also use iodine in appreciable amounts, including salivary glands. Low levels of iodine may lead to dry mouth. Skin. Your body uses iodine in the development of skin, teeth, nails, and bone. Low levels of iodine may lead to acne. Eyes. Iodine is an antioxidant that naturally protects your eyes against ultraviolet radiation. Immune system. Iodine is a scavenger of free hydroxyl radicals and stimulates the activity of other antioxidants. Muscles. Iodine deficiency may lead to pain, fibromyalgia, and muscle weakness. Pancreas. Radioactive iodine therapy is a common therapy in thyroid cancer. Studies demonstrate the radioactive iodine is also absorbed by the pancreas and predisposes you to glucose intolerance. Stomach. Iodine is used by the cells lining your stomach to concentrate chloride to produce hydrochloric acid used in digestion of your food. Iodine functions in a protective role against the growth of cancer cells. Although the exact mechanism is unknown, researchers have found that cancer cells shrink after injection with iodine, and some die and are then replaced with healthy cells. Iodine is also involved in apoptosis, or programmed cell death necessary for the development of new cells, and removal of malignant or diseased cells. Iodine is also vital to breast health in women who are breastfeeding and in older women. A deficiency may lead to fibrocystic disease or breast cancer. Human breast tissue and breast milk contain higher concentrations of iodine than your thyroid gland, as iodine is essential to the development of a newborn's brain. Women are much more likely to develop symptoms of hypothyroidism. Edward Toramanian, chief endocrinologist of the Ministry of Health of Armenia, notes, according to different research, women are having problems with thyroid gland 3 to 10 times more than men. This also applies to toxic goiter and insufficiency of thyroid hormones. In the U.S., hypothyroidism disproportionately affects women more than men, likely because the female hormone estrogen inhibits the absorption of iodine, while testosterone may promote the absorption of iodine. Therefore, what little iodine you consume from your diet is absorbed and used differently based on your gender. According to Fletcher's, hypothyroidism is associated with 80 to 90% free estrogen levels. This means the lack of iodine increases free estrogen levels that stimulate growth in breast tissue. The normal value of free estrogen is 40 to 60%. On the other hand, hyperthyroidism is associated with only 20% free estrogen. The interplay of estrogen, thyroid hormone, and iodine is a complex mechanism and increases a woman's risk of iodine deficiency. Iodine sources. Before the 1920s, the Great Lakes, Appalachians, and northwestern regions of the U.S. were known as the goiter belt, as 26 to 70% of children suffered from goiter. An iodine prophylaxis program was begun in Ohio in 1917 with over 2,100 schoolgirls. In the following years, the researchers found a significantly decreased frequency of goiter in the girls who received the iodine supplement over those who did not. It wasn't until 1924, after a successful iodination program in Switzerland and spurred by a series of reports, that table salt was fortified with iodine. However, recent research has found varying degrees of iodine in salt labeled iodized, and 53% of the samples had much less iodine than was listed on the label. Experts believe the declining levels of iodine in the U.S. population may be the result of several factors, including eating less salt and the mistaken belief it is bad for your heart, consuming more dairy substitutes low in iodine, such as almond, hazelnut or hemp milk, snacking on junk foods that are not salted with iodized salt, eating foods grown in iodine-depleted soil, drinking less dairy, which is often a primary source of iodine, eating little to no iodine-rich sea plants, such as kelp. Foods that contain higher amounts of iodine include sea vegetables, such as kelp, kombu and wakame. Kelp has the highest amount of any food and just one serving gives you 4 times the RDA. Organic, grass-fed butter is another source of iodine and healthy fats in your diet. Grass-fed butter is also high in vitamins, glycosphingolipids and conjugated linoleic acids that are important to support your overall health.